Hi, I'm Dr. Maheshwari, Assistant Medical Director, GarbhaGudi IVF Center. Today, let us discuss about semen freezing. So, semen freezing is a method of fertility preservation for males who require semen freezing when it has to be done. So, semen freezing is done in conditions when married at a later age who wants to pursue their occupation and they want to conceive after 4-5 years. That is, planning their family later after 4-5 years. Suppose they are at the age of 25-30 years. They want to conceive or plan the child after 5 years, after 35 years. In those conditions, they can freeze their semen for future fertility. And second most important is the males where they are having a occupational hazard. If their occupation involves where the heat exposure is more, like exposure like who are working in factories or those who are working in increased temperatures like traffic police, in a furnaces, all those things, or who are into the cooking business or into the eateries, in the hotels, restaurants where the heat exposure is more. So in those cases, and also in those people who are working with radiations like X-ray, gamma rays and all, whenever there is a radiation exposures, so in those males they can freeze the semen sample for their future fertility. And third most important, when the complex surgery is planned involving the pelvis or inguinal region or the femoral region where the damage to the testis is expected, in those cases before surgery they can freeze the semen sample. So fourth most is when the treatment is planned for fertility, like if they are planning for IUI or if they are planning for IVF ICSI, especially when planning for IVF ICSI, we freeze one semen sample. So just for a safer side, in case on the day of egg pickup, if they are not able to come to the hospital or if they are not able to give the semen sample because of stress or infections, this will act as a backup. And also, suppose if they are planning for IUI treatment or IVF treatment, but the husband has to go abroad or husband cannot come or he has some commitments, then he can freeze the semen sample and give the consent, and with the same sample IVF or IUI can be done. And fourth most important, whenever they are undergoing treatment like radiotherapy or chemotherapy for any cancers, before the treatment starts, they can freeze the semen sample and later on they can have their child. Thank you.